Hello everyone, welcome back to DC Conversations. Today we are in conversation with Dr. VVS Chandrasekharam, who is a senior pediatric surgeon at Ankura Hospitals, Banjara Hills, Hyderabad. Doctor, hello, welcome to our show. So you see so many abnormalities and kids who are suffering on a day-to-day basis. I mean, what's a typical day like for you?
See, my typical day has changed over time. If I go back to my training years, I trained in AIIMS, New Delhi. There was only one AIIMS then, now there are many AIIMS. So I trained in AIIMS. So there we did only three things: work, work, work. Nothing else. It was an extremely busy department. I spent 6 years in the department in AIIMS. It's an extremely busy department. So, and we used to get referrals from across the country. And so we used to, all the complex cases used to come to us. So especially those cases which are operated elsewhere and failed, for reoperations and all. So we used to do a lot of these. So extremely busy day. So typically that my routine would be there. Usually we reach the hospital on the day when we are sleeping in the room, because majority of the day we sleep in the hospital. But if on a day when I sleep in the room, then I typically reach the hospital by about 7:30 and start our rounds. We do our rounds. We used to do our rounds, because before the consultant comes, we have to see all the patients that you have admitted, and then you have, if I have assisted an operation, for example, if I was there in that surgery, then that patient is my responsibility. I should know everything about that child, what has happened, what has not happened, what has been done, what is not, how the child is doing, everything. We'd make the rounds, we write all the notes, then the consultant, 8 o'clock sharp, we used to have an academic program. 8 to 9 every day, academic program. So a lot of academics, including discussion of cases, then journal clubs. See, medicine is changing every day. Medicine is changing every day. So textbooks are important, but today, if a textbook has come out today, the information will be 5 to 10 years old. I've written 3 books. Recently, we have written one multi-author book. I'm talking specifically about the multi-author books, because majority of the textbooks, they have 30, 40, 50 authors. Because each chapter is written by one international expert in that subject. And there are 4 or 5 editors. Now imagine these editors, they plan to write the book. Then they send invitation to these experts in each subject. Sometimes there may be 2 or 3 experts in one subject, in one chapter. So one may be in UK, somebody else may be somewhere else, somebody may be somewhere else. You send to all of them. They are all busy people, obviously. So you coordinate with them. You make them write. They have to submit on time. Then you have to edit. So ये सब होते 5 to 10 years easily by the time a book comes. So we wrote a book, all Indians only, 4 editors, Indian editors. I am one of the main editors, chief editors. And then we had multiple authors from across the country. We published recently a book on pediatric minimal access surgery, laparoscopic surgery, keyhole surgery in children, about 70 chapters plus. We approximately took 4 years. The guy doesn't send the chapter, and then you keep on emailing. They are busy, and then they send. It's not in the format. Then you send them back. Then you have to attach photographs. They are not up to the mark. It's not a small thing. And then you do proofreading, you do the editing, and then you sit with the publishers. It's a big thing. So that is why the best way to learn the recent advances is the journals. So journal makes a very, very important part of medical learning. because somebody who does something new or come up with their recent data will post in a journal. By the time it comes in the textbook, it will be 10 years.
Yeah.
So that's why we used to have journal clubs where we had to, those days, I'm talking about 30 years ago, 25 to 30 years ago when I was in Delhi. So we didn't have all this internet access to all these journals and all. So we had to go to the library, take out the journals physically, then read, then mark the interesting articles, take them to the Xerox guy there. There used to be a Xerox guy there. So give it to him to get that article Xeroxed. Come back, read it, prepare, and then present it in the journal club. It should be a recent article out of interest, special interest to everybody. So the academic program. Then 9 o'clock, the residents who used to go to who were supposed to go to the outpatient clinic would go to the outpatient clinic. Those who were supposed to go to the operating room would have gone by 8 o'clock. They missed the academic program. The operating room guys, the surgery started at 8 o'clock. So we used to go to the operating room. Then you operate throughout the day. If you are in the outpatient clinic, you do the clinic, then afternoon special clinics. And then every day 2 residents are on night duty, 24-hour duty. We used to have about 6 or 7 trainees. You take 2 every day. So approximately we used to be every 3rd day we used to do nights. You do nights. So, and night means you come in the morning, you do all this work, stay back in the night, and lot of emergencies. Lot of emergencies. Because AIIMS was our unit was one of the few units in entire Delhi and surrounding areas who used to give emergency pediatric surgical cover. So most of the emergencies used to come to us. So operate throughout the night, and then in the morning you again do your operating, surgical work. You go to the operating room or the outpatient clinic. No day off. There is no day off. Then you do the evening rounds, then go back by dinner time to your room.
If a day is so stressful, are you able to sleep at night? Like if you have performed several surgeries in a day, like at least 2 surgeries you do in a day, or at least 1 on a minimum basis?
Now I do about 1 or 2 or sometimes 3, but those days there's no count.
Yeah. So how do you sleep? Do you really, what do you dream about? And you must be just...
we used to dream about boss coming and scolding us.
Exactly. I still remember, I still have nightmares where I'm in an exam hall and I'm late, or probably I can't remember the answer to a question. Because those are all like so traumatic for you. I can't imagine how it must be for you.
Especially surgical training was like that in these central institutes. So the system is called residency. So you're a resident. Resident means you are supposed, you don't have a business. My boss used to say, what business do you have to go to your room? Yeah. You stay in the hospital. I lost my father during my MBBS. I'm the only child. My mother was alone in Hyderabad with my uncles, uncle and aunt. So even if she comes to Delhi, what will she do there? So she used to be here. So I could not get I was entitled to 30 days leave a year. For 2 years, no leave. My boss never let me go. 6 लोग हैं, तुम जाओगे तो कम पड़ जाएंगे. No leave. So after 2 years, I said, sir, I have to go. I have to see my mother. I have to go. He said, why? Sir, I have to show myself to my mother. She wants to see me. He was just walking. He said, photo bhej de yaar. He said, photo bhej de yaar. So this was the kind of, and in between all this, you have to read. You know what I'm saying? And then you have to do your thesis work. We did experimental thesis and thesis work we had to do, because we had to submit 2 theses by the end of our training to be eligible to give the exam. And 𝐴IMS, our department, had a special thing that we had an animal lab in the department. So we used to go in the night to do our experimental thesis work on rats. I became expert in catching rats. We had to learn, how to catch a rat. I mean, it is in the cage, but if you want to catch it even within the cage, it can just, bite you. It can do anything. So, we used to wear those thick rubber gloves and go and catch the rat. And then in the night, because we had to do our experimental thesis study, get the results, and then, submit it to the thesis guide so that it clears for the exam. And then we had to study also the cases which were going to be done in the operating room when we are posted there. And let me tell you, in our department, 𝐴IMS, we had outpatient clinic 6 days a week, operation theatre 6 days a week. Every day outpatient clinic, every day operation theatre. So whenever I go to the operation theatre, I know the list, the previous day the list is made. So I have to check whether those patients are ready. Suppose somebody has cold, a child has cold or cough or fever, anesthetist will not give anesthesia. That is a contraindication to give anesthesia, general anesthesia, because kids, you can't do under local anesthesia, everything has to be general anesthesia. So then we have to know about that patient, you have to check them, check that their blood reports are all normal. I mean, tomorrow you take them to the operating room, the hemoglobin is low. Boss will kill you. So you have to know everything. And then suppose that child had a CT scan or something done, you have to have the films ready. These days we can access everything. From the radiology department, I can access everything on the laptop or the computer. Those days we had to go down to the radiology department, give a letter saying that I am responsible for these films. You can't lose the films. I am responsible, you give a letter, get those films, and it's your duty after the surgery to return them back. Because films are not there in the operating room, what will the surgeon do? You want to check, suppose there is a tumor, where is the tumor? Where is it going? What major structures is it involving? Then you have to, see the CT scan. You have to refer to the, this thing. And then you have to go, and how you do it, we don't know. How we did all these things in 24, we only had 24 hours. Okay. So you have to read about that operation. Why did I join? To learn surgery. So I have to read about that operation. What are the steps of the operation? Starting from how to prepare the patient. For example, I am doing I told you that anorectal malformation, that creation of the new anus, which is not there, the anus creation. So you have to give bowel preparation. The child is eating and drinking. So if you don't prepare, the intestine is full of stool. So if you operate on that, the entire wound will get infected with stool. So you have to first do a bowel preparation. That also you have to take care. Do a bowel preparation, and if the surgery is a major surgery, you see that the blood is reserved for next day. You may require blood transfusion during the surgery. And then you sit and read what surgery it is, and how to do it, how to position the child on the operating table. Starting from there. You position the child on the operating table. Some surgeries are done supine, some are done in the lateral position. If I am doing a neck surgery, then there is a specific position to extend the neck. If I am doing this side, you have to put pillows and, make the positions. So you have to read starting from there. And then how to make the incision and how to dissect and what are the steps of the surgery. Because my boss used to ask about all this. If I don't answer, he will throw me out of the operating room. I'm posted in the operating room. The first case is being anesthetized. The first child is being anesthetized. The boss would come. Padha hai? Have you read? Hindi will come because it's Delhi. I say, yeah, yes sir, bolo. Steps bolo. If you tell correctly, who knows, he may allow you to do it. That is also there. If you tell everything correctly and he's in a good mood, he'll say, Karo. And even if he's in a good mood, if you don't tell the steps correctly, he'll throw you out. So you lost a chance. You're hungry. You want to operate. You want to operate. And we were trained by great surgeons. Our consultants were really good in their work. So you want to operate like them. But how do you know how you will operate if you never do it? So you are waiting for your consultant to give you a chance to operate. And that will come only if they are happy with your work and with your, what you tell about the case. I'll tell you a very interesting incident. My boss, so he came into the operating room one day. I was posted with him. So there is an operation on the kidney in a 3-month-old baby. I cannot forget this. Some things you can't forget. They just stamp. So it's a 3-month-old baby who had only one kidney. Born with one kidney. Many children are born with one kidney. That kidney was blocked. Urine was not coming down freely. The pipe draining was blocked. So you have to do an operation to relieve the block. So you have to cut off that narrow pipe and join the pipes together, normal pipes. So the urine will flow freely and the kidney is saved, child is saved. Otherwise the child will go into kidney failure, dialysis and finished. 3-month-old baby we are talking about. That child was posted. It's called pyeloplasty. That operation. Now I do all these operations laparoscopically, keyhole. Those days we were doing open surgery. So it was posted. I knew everything about the child. Boss came in. Beta, pada hai? Ha sir. Bolo, steps bolo. I told him. You have to tell from the level of the skin. Position kaise banayega, how you drape, and then how you make the incision. The exact position, because if you open slightly lower or higher, you will go somewhere else. You cannot see anything there. You have to go exactly where the junction is. If you go here or here, you cannot see anything. Then you have to enlarge the incision. So then I told him. Then procedure. From the skin, then fascia, then 3 layers of muscles are there. 3 layers. So, and in between the second and third layer of muscle, nerves are there. If you damage that nerve, that muscle will become weak. So you have to know where the nerves are there so that you don't damage them. You cut those muscles or you retract those muscles gently, then go, then a lot of tissues are there, you separate them, then go on to the kidney and do this whatever. Then steps of the surgery itself. You can see reaching the kidney is the first step. After you reach, how will you how will you go there? How will you identify the portion? See, in computer, you will mark one with red, one with green, one with blue. Here, everything is same color. You go inside, recognize the structure for what it is not easy. So, how do you recognize it? And then steps of surgery itself, whatever. I told everything. He said, very good, do it. Do it. I said, no, sir, I won't do it. Believe me, half an hour he scolded me. तुम साले ऐसे ही बात करते थे. तुम साले, हाँ, they'll just treat you like a chaprasi. We have gone through everything, I am telling you. Your ego will just vanish. ठीक है? He used to say, and he said, you fellows, एक तो you keep crying that we are not giving you surgery. And when I ask you to do surgery, you don't have the guts to operate. अगर खून देके इतना डर जाते हो So why do you come for surgery? If you are scared of doing a surgery, why the hell did you come? You go to Hyderabad and open a pawn shop. That is better for you. This is exactly the words they used. Okay. So I said, sir, do anything to me, I will not operate this case. Why? Why? I said, sir, I have not done this surgery before. I have assisted many cases, but I have not done it myself. I have not done this surgery before. This is going to be my first case. This is a 3-month-old baby who has a single kidney that is obstructed. If I screw up this case, his life is gone. You know? Yeah. Normally there are 2 kidneys. One normal kidney, the other kidney, even if there is a major problem, this kidney the child will survive. 1 kidney is sufficient for normal life. I said, this is a solitary kidney of this child. That is obstructed. And you want me to do this as the first case, sir? I won't do it, sir. You throw me out of the OT, but I won't do it. So he was very angry still, very angry still. He said, वो सब तो ठीक है, but you don't have guts to do it. I said, yes, sir, I don't have guts to do this case. I don't have guts. He is in the hands of one of the best surgeons I have ever seen, and that is you. He was a fantastic surgeon. How can I deny that benefit to this child? Okay, Baba, at least open and expose the kidney. You know? Utna to kar loge. So then I opened, exposed the kidney, called him. The main part here, I said, I won't do it. I won't touch it. You do the main part. Cutting open and closing, I will do. I won't touch the kidney. I will not do the surgery. Finished. Then he kept on, once he goes into that mood, they don't come out so easily. So he kept on. Throughout, he was cribbing. Then he complains to the anesthetist. See, Doctor, these fellows, when I give them surgery, they don't do it. And when I go outside, then they say, sir, you're not giving us surgery. Look at these fellows. Then finally, surgery was over. Then he told, after some time, he said, he cares for the patient. Yes, he's a good boy. And then he gave me a lot of surgery to do. He gave me a lot of, and it's why I am recounting this experience is, now I have done the largest number of the pyeloplasty operations by laparoscopy in the country. The first case which I refused to do, that same operation, I have now done the largest number in the country, maybe in the world, for a single surgeon. I have now done more than 900 of these.
Oh my God.
Laparoscopically, not open. Open I have done many more. I am talking about only keyhole surgery. We have done open surgery for a very long time. About 15 or 16 years ago, I started doing keyhole surgery for this operation. So, this only keyhole surgery, I am talking about 900. Open, we have done many before. So, I think karma comes back.
So when you've been in a very intense mood throughout the day, and you've operated and all that. So after performing so many surgeries and seeing patients and maybe parents in pain, patients, kids, especially kids, pediatrics, it's not so easy. How do you switch off when you have to actually get back home? And
2 aspects here. That even if, suppose I do a very complicated operation, even when I go home, when I'm talking to my kids, my wife, my mind is here.
yeah,
And the moment I go home and say hello to my wife and sit, and within 2 minutes she says, "You done something major today? How is the kid?" she asks first. Because, she knows.
Yeah.
So it happens. Even after, say, now, in 1995, I joined AIMS. So it's 30 years. And Hyderabad, I've been practicing for 24 years now. So from AIMS, I directly came to Hyderabad. Still this happens.
Yeah.
Because I feel my responsibility for some other's kid is much more than my responsibility for my own kid.
Right.
This is my personal feeling.
Yeah.
Sometimes I feel that, see, what is most dear to a human being? One of the most dear is life.
Yeah.
The second will be your children.
Right. Yeah.
If you have children, that is the most dear thing, next only to your life. Maybe sometimes more than your own life.
Correct.
We know many parents who sacrifice themselves for the kids.
Yeah.
So if a family or parents are bringing their child to me and they are letting me cut open that child, let me put it very bluntly.
Yeah.
If they are letting me take a knife, cut open that child and do whatever I want. Obviously I don't do whatever I want, but you can do whatever I want, isn't it?
Yeah.
I mean,
Right.
technically.
Correct.
Once I'm in the operating room, who's going to see what I'm doing?
Yes.
If they have such confidence, then sometimes my shoulders cannot take that weight. You feel the weight
Correct.
on your shoulders. How can anybody allow their kids to be cut open by somebody else or whoever it is?
Yeah.
So it's a big responsibility. So apart from being a human being, at least those kind of errors and shortcomings which are avoidable. There are some things which we cannot do anything about. It's not in our hands. It's not totally in our hands. But majority of these things are avoidable by various ways. Preparing yourself well for the surgery. If there is anything to read up, I read up again. If I have to go through my previous videos, I go through the videos. In complex cases, we still discuss among ourselves. I call up my friends, we discuss. So, whatever from our side is possible, we do. And pre-operatively, we discuss with the anesthetist. If it's a complex case where anesthesia is going to be critical, we discuss with them that this is our plan. How do you plan to give anesthesia? It's a very, you have to coordinate. It's a very, so it's like an orchestra. So that responsibility we always feel. That I mean, it's good, but that shows on your health.
Yeah, definitely.
It shows on your health because you are tense for many things. You are tense over many things. Now, I don't take emergencies now because I have juniors and they take emergencies and all. But when for about 15 years plus in Hyderabad, and I was doing emergencies. In the nights also, I used to get calls and all. So when the cell phone rang in the night, I used to wake up with a start. And the heartbeat never used to settle down for at least some time. First thing is it something, especially if it's from the hospital,
Yeah.
then, I have operated that kid today. How is that kid? Unfortunately, human mind, negative things come first. Yes. The moment there is a call, negative. Kya ho gaya? What happened? Yeah. So that shot of adrenaline, that shot of stress is sufficient to, and that too multiple times. It's not once.
Yeah, because do you feel nervous every time you get into the OT, even now after performing so many surgeries?
I feel nervous. That's because the responsibility again. Yeah. See, we need to understand. I tell the parents also many times, these numbers and all what we talk about. If I say a surgery is 95% success, see, every treatment, being a surgeon, every surgery, no surgery has 100% success. Nothing has 100% success in anybody's hands. Yeah. Sachin Tendulkar got ducked out many times. What are we talking about? There is nothing called 100%. In fact, that way, the strike rate of doctors is far better than our cricketers. I am telling you. Yeah. Even when I do a very major surgery, complicated surgery, my success rate is far better. I am telling you. But still it's not 100%. Yeah. So when you do the surgery, if I tell the mother, okay, in our hands this surgery has a 95% success. Internationally also. I usually quote the international papers. I still read a lot. I publish a lot. I published about 85 international papers and 3 books, as I said. So I quote from international and my own data. I have my own data. So I tell them. When I tell them, they don't have 100 children who are being operated by me. Yeah. They have only 1 child. So for them, whatever happens is 100%. Ye percentage is good to discuss in meetings and conferences and all that is fine. Over a cup of coffee you discuss. Yeah. But for the parents, yes, it is our duty to tell them percentages, but practically speaking, that 1 child is either 100 this way or that way. So that is why still every case we take extremely seriously. Yeah. Even if I tell you the same operation, I said I have done more than 900. Even the 901st operation I take the same way as I took the first surgery. Yes, I probably will be doing little faster now, and I know the that process. Yes. Yeah. But inside, the care which I take with the tissues, the everything will be the same. We can never become careless. We cannot. Because that day, that child is the most important thing in my life. Yes. You won't believe. My wife calls, I don't pick up the phone. When I'm operating, in fact, she doesn't call. She calls my secretary. However important something may be, she will not call me. She will only give information to my secretary, because she knows being disturbed by any other thought at the time of surgery, I don't like. So, I think this will continue till the last surgery that we perform. But unfortunately, these are the things which are actually leading to a lot of, doctors giving up their this thing. What you call, there is a word for it, isn't it? What is it called? It's called breakdown or not breakdown. There is a word, burnout. It's called burnout. There is a word for this. Now, doctor burnout is a big topic for discussion in the West.
So, at what age are actually doctors giving up their profession now?
Doctors are giving up during training itself, some of them. Those very sensitive people who cannot take, they give up at the time of training. Some after a period, they work for some time. See, what happens is, madam, anything going wrong is a trauma for the family. Trauma for the family. And in medical profession, the doctor who is treating or who has treated is directly in front, facing the brunt. So, when you think from the doctor's angle, there is actually a term called second victim syndrome. There is a term. There are a lot of public. I gave a talk on this in one of the meetings actually. It's called second victim syndrome. Very few people know about this. And it's specifically medical, in medical profession. Second victim syndrome means, suppose a patient had a complication. Medical treatment, surgical treatment, patient had a complication. That patient who had a complication is the first victim or is the only victim according to general this thing, but the doctor is the second victim. Nobody thinks in these lines. The doctor goes through extreme pain when you feel that something is directly attributable to what you have done or not done. Act of omission, act of commission, both can be there. So many doctors feel extreme pain. And that's a very dangerous phenomenon. Second victim syndrome is a very dangerous phenomenon. So somebody who has had a major complication, again, as I said, sometimes it is in our hands, sometimes it is not in our. It's like accidents. So anybody who has had a major complication in their practice, they go through a lot of. So after that, it's very difficult for them to attempt any major procedure. Even though they may be very good at the work, but uske baad it becomes difficult for them to attempt a major operation if they are a surgeon. And slowly it eats on your. So what I do is, I have music as a passion. So I sing, I listen. So that's one way. I read books. I have a lot of interest in Indian philosophy. So I read, So I think these are the things. And of course, family. Family support is extremely important. My wife has been a great pillar of support. I mean, I should acknowledge. Without her, I would have been not even 50% of what I am today. She did not work just for this, just so that I can build my career. She did not work. She could have easily worked and gone to a very decent position by now. She was an IT specialist when IT was started picking up and going to peak. So she didn't work. Then she looked after, I have 3 kids, so she looked after my kids. And she sorts out everything at home. Everything. I have no idea what bank account I have, how much money is there in my account, what loans I am paying, what EMIs, I have no idea. Zero. She takes care of everything.
That's very important.
That family support, extremely important. At least in my case, I have been extremely lucky that way. So right now, my day is much simpler, madam. So when I came to Hyderabad in 2001, the second phase, when I was trying to establish myself in practice, I was trying to acquire new skills. Laparoscopy was just coming up. So adults laparoscopy was coming up. Pediatric, nobody was even talking about laparoscopy. When I talked in 2003, I went to an international meeting where I saw a Hong Kong Chinese guy from Hong Kong. I mean, he showed videos of advanced laparoscopic surgeries in children. I saw that. I said, what is this guy doing and what am I doing? But that served as an inspiration. It served as an inspiration. The moment I came back from the meeting back to Hyderabad, I said, I have to do this. So then you have to learn first. It's a new skill you have to acquire. So then we went to whatever courses, we trained ourselves, those days this YouTube and all these were not there. So somehow we acquired this one. Then I had to buy my own equipment because no hospital was ready to invest money on a new technology about which they knew nothing. Yeah. So I took a loan from a bank at 16% interest, personal loan, and bought my own equipment. I used to put it in the back of my car and travel. I was freelancing those days. Travel in Hyderabad, hop from hospital to hospital, and start the open surgery, what we used to do, start doing it laparoscopically. Start with basic procedures. You can't do a major operation like a pyeloplasty suddenly. So you start with basic procedures and then gradually advance yourself to the bigger and bigger procedures. Again, all this was because my wife's support. She was very supportive. So I was very busy those days because I used to travel, I used to roam around, my own equipment and everything. So now, of course, my routine is much more comfortable to say. So I don't do much emergency work now. Basically, it doesn't come. If it comes, I do, but I don't really. So my patients, they find me. I get patients from across the country now. So somehow they find me, and I still operate 6 days a week. I still see my outpatients 6 days a week. But the timings are much more. So there are two ways. Some surgeons, I know what they do is they keep 2 or 3 days a week as the operating days. So they operate from morning to evening, 3, 4, 5 cases, whatever number are there, they finish off on that day. The next day they see only outpatients and they don't do surgery, unless it's an emergency. My problem is, if I do 4 cases in a day, and most of my work is major. I don't do much minor surgery, somehow they don't come. I don't do much minor work. Most of my cases are major cases. If I do more than 2 or 3 major cases a day, will I be able to do justice to the 3rd or 4th patient? Because I'm a human being. Right. I'm 50 plus now. I don't have the same energy what I had 15, 20 years ago. So will I be able to give the same kind of, attention and my system? Will my hands function the same way? We use very fine sutures. I use magnification to do some of the surgeries. I told you that penile surgery, that hypospadias. I wrote a book on hypospadias actually. So for that, you need a lot of attention, a lot of concentration. Takes 2.5, 3 hours to do one case. So you wear those, magnifying this thing, and you operate with very fine instruments and very fine stitches. After 2-3 hours, I get a little headache and, little this thing. So if I do 3 cases of that, I'm damn sure the 3rd case I will not be able to give the same, this thing. I will not be able to give my best. So I space out my work. I operate every day, but I never do 4, 5, 6 cases in a day. 1, maybe 2, at the maximum 3 if there's an emergency.
It was a refreshing change from the usual, topics we discuss with a doctor. Yeah, this should give a lot of insights and probably some kind of a direction to those also aspiring to become doctors, all the medicos, what to expect. And I'm sure, maybe things have changed now, but I guess the more or less the procedures and the learning is always there, right?
Yeah. What exactly happens is, I think, especially a profession like doctor should be kept away from the other aspects which might trouble an individual. This is my personal, of course, my wife has taken it in my case. Otherwise, what happens is your mind will not be there. And we need a very serious presence of mind, especially if you're doing the higher level of work. If you're doing only basic this thing, that's all right. But as the higher you are going, the more complex work you are doing, it is really cutting edge. It's really cutting edge. So one little bit fault this side or that side, I won't say fault, a little bit deviation, I would say, can cause a major change in the outcome. In the outcome. So that is the reason why I think this profession is, but it's very rewarding. It's extremely rewarding.
Yeah, you have the satisfaction.
It's extremely rewarding. That is always, and there are many patients who come to me for surgery, and I actually say you don't need a surgery. That is something which is again phenomenally rewarding. You know? So, see, again, medicine, unfortunately, unlike mathematics, it's not a perfect science. It's an imperfect science. It's not a perfect science. For example, in mathematics, 1 plus 1 is 2. Whether a class 1 child answers it or whether a supercomputer answers it.
True.
It is always 2.
Yeah.
In medicine, 1 plus 1 can be anything.
Yeah.
You know, nothing was more, this was evident in a big way during COVID.
Yeah.
You know, so much individual variation, so much individual, the same COVID virus,
Yeah.
somebody got it and they didn't even know they got it.
Yeah.
Blood test says positive, but you never had even have a cough or cold or even fever.
Yes.
Somebody got it with mild symptoms, mild flu-like symptoms, took paracetamol, gone. Somebody got it with severe symptoms, required admission and all those special medications. Somebody else got it within 24 hours, finished, gone.
Yeah.
You know? How do you explain this? It's the same virus. It's not a different virus.
It affected different people differently.
Differently.
Yeah.
So there is a big element of this human body.
Yeah.
So the same medicine which I use, so what we do is, we do what works in the majority.
Yeah.
We do what works in the majority. We cannot think of, we cannot give what works in 2%, we can't give to 98%. We give the 98% what works, we give to everybody. And if it doesn't work in somebody, then we think of plan B.
Yeah. True.
So this aspect should be emphasized. And this aspect should be understood by patients also.
Yeah.
These days there is a lot of misunderstanding. I'm not saying that there are, just like any other system, you can have good and bad in every system. Even in the medical system, there is a good and bad. You know, we know what we're talking about. But saying everybody is bad, labeling everybody as bad, is something which is difficult. So even if you have done something in the best of interest and in the best of, this thing, sometimes it may not
Work in your favor.
work.
True.
So this is something actually which is causing a little bit of, many doctors are getting affected by this psychologically. Because you say, even after 30 years of struggle and you have done your best, one case there is a problem, then you are pictured as a demon. You know what I am saying?
Yeah.
So it becomes very difficult to and somebody says, chodo, leave it, I am good. This is something which the public should understand. Doctors are not gods. We should not play God at all.
True.
We should not play. Gone are the days. Previous days, I think doctors used to play God. But we should not play God. We should not play God. So I tell many of my, my parents ask me, sir, if you are doing the surgery, we have got the equipment, you are well trained and everything. Still, how can it go wrong? Still, how can it go wrong? You know? Because I say 95% success, 98% success. For a particular surgery, there is a success rate, and these are all, as I told you, I quote from the international literature and my own results also. Then I ask them a question. See, you have got a kid, say you have got an older kid who is very smart, intelligent, hardworking, wants to go into the IIT. You put him in the best school, and you have put him in one of these, whatever, top coaching institutes. He has worked hard. Is there a guarantee he would get into it? He is intelligent. He is hardworking. Put him in best school. Spent a lot of money in various ways of coaching and training and teaching and learning. Is there a guarantee that he would get into IIT or NEET for that matter? So there is something else. Yeah. There is another factor which unfortunately is not human.
That's true.
That is something which we need to be very, we feel, I'm telling you, madam, we feel extremely bad when something goes wrong. We feel extremely bad. Yeah. We feel so bad that our whole family takes the brunt.
That's true.
But still, there are a few things which are not in our control. So I think the public should understand this. People should understand this. What is happening is, the society is losing a very well trained and qualified and experienced doctor. At 45, 50, you have the best of everything. Like you have been trained, after that you have had adequate experience also. And you are not so old, you are not 70-year-old where you might, you might tremble when you are operating. That age, 45, 50, 55, that age, doctors are at their best. Yeah. They have the best of everything. They have been trained, then they have had adequate experience. Because experience teaches you much more than your training. Yeah. And then they have the health also to actually keep them going for long hours and True. So at that time, I've seen a lot of doctors getting affected by this. I've seen a lot of doctors getting affected by this. So then they say, chodo yaar.
Thank you, doctor. Thank you so much for the wonderful conversation.
It's a pleasure. I enjoyed it.
I'm glad.
I enjoyed it.
Thank you. Thank you so much.